Bismillahirrahmanirrahim. So after myopathies, the next topic is neuropathy. So let's talk about neuropathies today, right? So let's talk about neuropathies, right? So we have two classifications for that. One is anatomical classification, right? Another one is called as the pathological classification, right? According to that, according to anatomical classification, we can divide the neuropathies into mononeuropathy, or if the patient is having mononeuritis multiplex, or we can also call it as the multifocal neuropathy, right? This is also called as the multifocal neuropathy, right? And if the patient is having polyneuropathy, right, so we can divide anatomical classification into three: mononeuropathy, mononeuritis multiplex, or also known as multifocal neuropathy, and into polyneuropathy. And in pathological classifications, we can divide the if the patient is having the mainly motor involvement, right, like GBS, right. If the patient is having mainly sensory nerves are involved, and if the patient is having mainly autonomic nerves are involved. So this is a pathological classification for that. So let's talk about anatomical classifications right now. So first one is called as the mononeuropathy, right? So it is usually seen with the trauma like wrist drop and the foot drop. We know that in wrist drop radial nerve is involved, right? And it can also be seen with the entrapment neuropathies. Right? Entrapment neuropathies. So we see mononeuropathy in this condition. The second one is called as the mononeuritis multiplex. This is also known as multifocal neuropathy. So in this neuropathy, there will be lesions of multiple nerve roots. So, right, so we'll have the multiple nerve roots are involved in this condition, right? So at two different sites like peripheral and cranial nerves are involved, right? So we can see the Bell's palsy, and along with that, if the patient is having foot drop, so two different nerves are involved. So when there is multiple nerve root lesions, we're gonna call it as multifocal neuropathy, right? So let's discuss the causes of the multifocal neuropathy, right? So the mnemonic is the Ward's place, right? So we'll have this mnemonic here that is called as Ward's place. All right. So W stands for the vaginous granulomatosis, amyloidosis, right? Rheumatoid arthritis, diabetes, sarcoidosis, pan, uh, polyarthritis nodosa, leprosy, and cancer. So these are the important causes of mononeuritis multiplex, also known as multifocal neuropathy. So basically, we're going to see the inflammation of the vasa nervosum in these patients. So vasculitis is an important cause of that. So vasculitis is important cause of the mononeuritis multiplex, right? I would like to discuss the one of the important cause of the neuropathy of the upper limbs, that is called as the multifocal motor neuropathy, right, with conduction block, right. So this is a pure motor neuropathy. It typically affects the arms, right. It typically affects the arms, and it is a pure motor neuropathy, right. And it is associated with anti-GM1 antibodies like that we see in the GBS patients, right. Anti-GBM1 antibodies, and it responds to IVIG, intravenous immunoglobulins, right. So this is the multifocal motor neuropathy with conduction block is an important cause of the important one of the type of mononeuritis multiplex, right. So let's talk about polyneuropathies, right. So in polyneuropathy, usually it is length dependent, right. That means, more longest peripheral nerves are involved first. Longest peripheral nerves are involved first in these patients, right? This means mostly the lower limbs are affected in the polyneuropathy condition. But there is an exception for that. If there is an inflammatory demyelinating neuropathy. So in these patients, the mostly upper limb is affected than lower limbs, right? Usually we see the longest peripheral nerves that supply the lower limbs, right? So those are affected first in polyneuropathies. So let's discuss the causes of the polyneuropathy. So we have the metabolic cause that includes diabetes, hypoglycemia, uremia, and hypothyroidism, right? The next thing is inflammatory cause that includes GBS, CIDP, right? That is chronic inflammatory demyelinating polyneuropathy, right? And infections that include leprosy, HIV, syphilis, Lyme disease, and brucellosis, right? So these are the important causes of the polyneuropathy, right? If we talk about nutritional causes, so B1, B3, B6, B9, B12, right? Along with that, vitamin E. So these are the important causes of nutritional polyneuropathies. If patient is having deficiency of these vitamins, so patient is going to develop the polyneuropathy. Another cause is autoimmune. So vaginous granulomatosis, rheumatoid arthritis, sarcoidosis, right? Polyarthritis nodosa, right? So all of these conditions are going to affect the vasa nervosa, and that's how they're going to cause the polyneuropathy. In the next, we have the drugs like isoniazid. We know that we add the vitamin B6 in these patients, right? So isoniazid, that is an ATT, one of a part of anti-tubercular therapy. So this is going to cause the polyneuropathy, right? So another one is the phenytoin, then we have the lead, then we have arsenic, vincristine, cisplatin, metronidazole, and nitrofurantoin, right? Along with these drugs, we have one drug dapsone, one drug that is called as dapsone, and another one is the ethambutol, right? Ethambutol, right? And along with that, amidrone. So these are the important drugs which are going to cause the polyneuropathies, right? So we have the inherited form of this polyneuropathy. One is called as the porphyria, another one is called as CMT, right? Charcot-Marie-Tooth disease, also known as hereditary sensory motor neuropathy, right? Another one is called as the Refson syndrome, right? So these are the important cause of inherited polyneuropathies. And the last one is polyneuropathies associated with paraneoplastic syndrome. So we have Eaton-Lambert syndrome that is associated with small cell lung carcinoma, right? So that's all about the important causes of the polyneuropathies, right? So I have talked about the mononeuropathy. Usually the cause is trauma or entrapment. The second one is the mononeuritis multiplex. The mnemonic is Ward's place, right? So in the polyneuropathy, we have the inflammatory cause, metabolic cause, infections, nutritional deficiencies, autoimmune drugs, and inherited and paraneoplastic syndromes, right? So let's talk about pathological classifications right now. Okay, let's talk about this thing. So if the patient is having the mainly motor symptoms involved, if a motor system is involved, like in the patient with GBS, right, we're going to call it as AMAN, acute motor axonal neuropathy, right? So this is one of the cause of that. Along with that, we have the lead. This is also gonna cause the neuropathy, right? We're gonna see the motor symptoms in these patients. There's an CMT, Charcot-Marie-Tooth disease, right? This is basically an autosomal dominant condition. I'm going to discuss it in the next on the next page, right? So we're going to see the bilateral common peroneal nerve, common fibular nerves are involved in these patients. So basically, chromosome number 17 is involved, right? So this is called as CMT, Charcot-Marie-Tooth disease. So mainly sensory nerves are involved in diabetes, uremia, and leprosy, right? So if we talk about mainly autonomic nerves are involved in GBS, right? That is AIDP, right? Acute inflammatory demyelinating polyneuropathy. We have the four important types of GBS. So one of the important causes is AIDP, in which we're going to see the motor, sensory, and autonomic nerves are involved in these patients. Along with that, diabetes, HIV, and Lambert-Eaton syndrome, and leprosy, right? So these are the causes of the um, autonomic insufficiencies in the patients, right? So let's talk about CMT on the next page, right? So that's all about pathological classification. I'm gonna discuss GBS in the next section. Before that, let's talk about CMT. So Charcot-Marie-Tooth disease, also known as hereditary sensory motor neuropathy, right? So this is a basically autosomal dominant condition. Chromosome number 17 is involved in these patients. So we're gonna see the bilateral common peroneal nerve palsy in these patients, right? And there'll be inverted champagne bottle appearance in these patients, right? And mostly the in puberty, patients gonna come with bilateral foot drop, right? So that's about the Charcot-Marie-Tooth disease. Alright, so let me revise this again, that in Charcot-Marie-Tooth disease, basically this is an autosomal disorder, autosomal dominant disorder. In this condition, there is common peroneal nerve palsy, and there will be demyelination and remyelination of that, and because of demyelination we're gonna see the onion bulb appearance in these patients. If you get the nerve biopsy, so we'll see the onion bulb appearance in these patients. Also, there is another condition that is called a CIDP, chronic inflammatory demyelinating polyneuropathy. You're gonna see the onion bulb appearance in that condition as well. So because of the involvement of this common peroneal nerve, we're going to see the atrophy of the peroneal muscles, right? Atrophy of peroneal muscles, right? So in this condition, right, so patient is going to come with the bilateral foot drop, right? And if we check the because of atrophy of the peroneal muscles, so leg will be like this, right? Inverted champagne bottle appearance, right? So we're not going to mix this with that of Duchenne muscular dystrophy, in which there is pseudo hypertrophy of the in this condition we can see the atrophy of peroneal fibularis muscles, right? So if there is pseudo hypertrophy of the calf muscles, that is seen with the Duchenne muscular dystrophy, right? And if there is weakness of calf muscles, that is seen with the Emery-Dreifuss muscular dystrophy, right? So these are the three conditions. We're not going to mix with, confuse with that of Charcot-Marie-Tooth disease. That is basically a hereditary sensory motor neuropathy, right? So I think that's all for today. I'm going to discuss the GBS, one of the important cause of the neuropathy, one of the important cause of flaccid muscular weakness. So I'm going to discuss this in next video. That's all for today.